Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. Today, let's take a look at how you can heal pneumonia with natural and effective therapeutic tools. Pneumonia is the single largest infectious cause of death in children globally, with about 2,500 children dying daily worldwide, and about 7% of all death in adults. And did you know that there are more than 30 different causes of pneumonia? Of course, not every case is serious and life-threatening, like the walking pneumonia, which is a much milder type, but it's good to know what to do about it, especially during the time of the pandemic. So enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs up and likes as they support the growth of my channel. And lastly, have a look at my website, medicanova.net, at the online academy, where you will find certified comprehensive home study online courses in homeopathy, integrated medicine, and health and wellness coaching. So what is pneumonia? Pneumonia is a type of respiratory infection that affects the lungs. And pneumonia infection can be either bacterial or viral, which partially then determines the type of pneumonia symptoms that someone develops due to having the illness. Initially, when someone develops pneumonia, symptoms are about the same, right? It doesn't matter if it's bacterial or viral. So you maybe have a fever, the dry cough, the headache, the muscle pain, the fatigue, and the weakness, all sort of flu-like symptoms. But feverish symptoms tend to get worse, however, within several days when the pneumonia infection is more bacterial in nature. Most people start to display more severe pneumonia symptoms within about 3 days of the infection taking hold, including maybe having even trouble breathing. Right? The cough starts to come up, there's mucus, developing higher fevers, and in some cases, the viral pneumonia causes more symptoms than the bacterial cases do, but honestly, that really depends on the individual as well. Is it contagious? Yes, it is, right? It can be spread from person to person, but it also really develops in other ways too. Now, the same types of bacteria or viral pathogens that cause pneumonia infections are actually already present in our bodies, right? In the airways or in the sinuses, especially in children, because they are locked there in the noses and the throats. Now, the real problem starts when these organisms then enter and infect the lungs. But you have to have a certain foundation, a certain susceptibility to even make that happen. Now, how strong someone's immune system largely is determines whether or not these organisms have the chance to spread, to proliferate, and therefore cause the acute lung infection. So this is an immune system issue, right? In here we talk about prevention as well as treating the acute pneumonia. But even during the acute pneumonia, you can boost your immune system to speed up the recovery time. And that's why it's so important to improve your overall immunity, which is really the best way as a protection as well as meeting the situation right on. So what are the symptoms? Usually persistent coughing. Sometimes it can be quite painful, like a burning or stitching pain, coughing up mucus, small amounts of blood even, but usually the mucus goes from yellow to green and you know there is an infection happening. Trouble breathing, right? There may be shortness of breath, or you feel there is an oppression on the chest, like a weight sitting on your chest. Especially if it's viral, then we have the wheezing going on, and also if you have asthma prior to that, that makes it worse too. I talked about the chest pain, but they're usually worse when you're moving around or want to breathe more heavily. Fever, I mentioned, can be very high, even especially during the bacterial pneumonia, can be 105 Fahrenheit, so don't be surprised if the fever goes really high. With it comes the chills and the headaches and the stomach aches, the confusion, the disorientation. If you have high fever with children, you see a delirious state even happening. I've seen others who have nausea and vomiting and gagging. That can happen as too with this coughing, in children especially. Sometimes we see rapid heartbeat, rapid breathing, changes in skin color even. And in infants, I would say there can be complications, right? Because they may be unable to drink, so dehydration can be even go into convulsion or unconsciousness, but that's what this video is not about. We want to keep it very simple and share with you really effective home kitchen pharmacy, so to say. Walking pneumonia is a non-medical term to describe the mild case of pneumonia. Usually it's bacterial in nature. Most cases of walking pneumonia are due to a bacterial microorganism called Mycoplasma pneumonia, which is contagious and spreads like any other types of pneumonia. So how long does pneumonia, really last? Well, as I said, it depends, but usually it starts, between 3 to 7 days. Others have it only for a day, but it's most unlikely, while others usually, drag it out till 10 days. Most struggle actually, with pneumonia symptoms for about 2 to 3 weeks to really feel like they got over it. What are the causes? Pneumonia is caused by a variety of infectious agents and develops when the lungs become filled with pus and mucus. That's why it's so dangerous, making it hard to breathe, get enough oxygen, and also to control your breathing. The parts of the lungs that are most affected by pneumonia infections are the alveoli. And these are small little sacs. I put a picture up here that normally fill up with air and oxygen and allow also someone to breathe properly. Now, researchers believe that there are 5 main infectious agents that are the primary causes of pneumonia. And as I said, there are certain type of bacterial infections, and this most commonly includes Streptococcus pneumonia in children, with Haemophilus influenza type B. That's why we have the hip vaccination. Pneumocystic gyarrhea, another type of bacteria that is associated actually with the death due to pneumonia in children with viruses such as HIV. Then we have viral bacteria, and this type of pneumonia is often called the respiratory syncytial virus group. And mycoplasma, that's often related to the walking pneumonia, but then we have also other organisms like fungi. And here we talk about Candida albicans, Histoplasma capsulum, or Aspergillus fumigates. So your environment here is very important. Of course, indoor as well as outdoor. Are you exposed to certain fumes? What's happening? Mold. And of course, exposure to certain chemicals, such as fumes and tobacco smoke especially, which all deplete and weaken the immune system. So infectious agents that cause pneumonia can be transmitted, of course, from person to person. Usually it's through inhaling, right? Organism can be spread via airborne droplets, or being near someone coughs at you or sneezes onto you, but also being exposed to blood from someone with pneumonia. And here I want to mention pregnancy and delivery. So if the mother is already infected and is ill, the infant can become infected after being exposed to her blood. The usual risk factors are anybody who has a chronic tendency for upper respiratory diseases or lung diseases, COPD, cystic fibrosis even. And I would say here the elderly are really more affected, right? So make sure that the nursing homes, because that's a tight environment, are really free of these pathogens. In children, of course, having any form of chronic respiratory disease, frequent respiratory infections, especially if there are severe allergies involved or asthma even. Having a weakened immune system in general, maybe due to illnesses like autoimmune disease. I also would say malnutrition lack of safe drinking water, or undernourishment due to poor diet. Certain medications also lower the immunity, and that can be a contributing factor. In infants, they say, breastfed children are better off than bottle-fed children, and I always say, I actually verify that. Of course, if you are prone to respiratory diseases, smoking is out of the question here. It doesn't work, right? Having difficulty swallowing, right? If you have a history of other medical problems, maybe Parkinson's disease or stroke or dementia, cerebral palsy, that can be maybe a part of that as well. And exposure to air pollutions, I think that is a big deal for me here, particularly indoor as well as outdoor. Maybe fumes, you're exposed to all the time, biomass fuels and all of that. Stay away from that. Also, people who just actually had a surgery or recovered from a trauma. We talk about that in the food for thought section. Pneumonia could be part of that. So what is the conventional treatment? Well, most of the time, especially if it's bacterial pneumonia, you get prescribed amoxicillin. But if it's viral, there's nothing there, right? The antibiotics won't work with the viral infections. So it's more of a case of waiting it out. And this is where this video is so helpful, because here I give you the indicated remedies to tackle this situation, especially if it's viral. So most people don't require hospitalization unless complications really develop, so they have a very high fever in the infant, or the child is so poorly, of course, then you have to go to hospital. Vaccines were developed, especially the Hep and the pneumococcal conjugate type. I feel like as a homeopath, I want to say, be careful with that and educate yourself before you go into the vaccination part. If you are interested in a health consultation, either for yourself and or your children, contact me at Medicanova at health@medicanova.net. Medicanova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, health and wellness coaching, and so much more. Book your appointment today. Let's move on to the third part of this video, food for thought, or the metaphysical meaning. As with all of my videos, I want to spend some time with you to look behind the physical symptomatology of pneumonia, which has all to do with air, right? How I breathe, what I cough up, what's going on in your life. And here I want to refer to Jacques Martel references, who expresses this very well. And he says, as the lungs are the organs of respiration that produce the transformation of my air for my whole body, I'm experiencing an inner conflict that has gravely weakened me. I must therefore identify the emotion or the feeling that is irritating and limiting the functioning of my relation with the air of my inner life, because these blockages are preventing me from living fully. And these feelings are deeply anchored within my being and represented by the inflammation, maybe telling me that I'm deeply offended and irritated. So when someone has an inflammatory situation in the lungs where we have pus, we have mucus, and not just clear mucus, but yellow and green, it sits deep, right? It's more severe. And therefore, really look at your life, your work environment, your relationships, your marriage, even your children, your relationship, whatever it is, what sits deep, what really bothers you. This irritation is an integral part of me. It is like a reflex, and it brings me many negative feelings. I must ask myself, what is the situation or the person that makes me feel so much hate and is often present in my work environment? What's your relationship with your boss, with your work colleagues? My ability to breathe becomes very affected by my emotions, my fear of being alone or overwhelmed, by my revolt against life. I feel I'm mixed up in my personal relations. I may feel stifled by all my responsibilities, and I don't know how to get out of it. I'm overcome by discouragement and despair, and I even ask myself what the meaning of my life is and if it's truly worth the effort to live it. You see how deep it goes? Pneumonia is, people can die of. And you see that during the pandemic here as well. But I question, with the ones who were really affected and are really passing, unfortunately, what was their emotional state prior to that? Was that maybe a contributing factor as well? I feel that anyone can invade my space and take something from me. I feel that I'm not living fully. I ask myself questions about my personal progress, and I'm seeking a new meaning of my life, wanting it to be richer interpersonally, and wondering what the place of spirituality is in my everyday life. I feel vulnerable, and I'm not clear yet about how to achieve my ambitions. I project a strong man, or a strong woman, doesn't matter, image, but deep down I feel helpless. I'm tired of living, and despair is overtaking me. That's exactly the feeling when someone has pneumonia. They feel they have despair. I can't breathe. I want to live my own life, and not the one plotted maybe by my parents or by your husband, right? As somebody who you feel controlled by. I'm ambushed because I find it very difficult to make contact with my entourage. My job no longer satisfies me and doesn't fit my aspirations. So what would be the positive affirmation here? Well, you get the idea already. I accept that I need to take some time for myself and clean up my life. I think that's important. That's why, people with pneumonia are just out of, they're taken out of life. They need a serious break. I keep only those responsibilities that are properly mine, and I return to the rightful bearers those that I took on my shoulders, but were not truly mine. I give myself the right to ask for help. I think that's very important here. Life will thus be easier and more beautiful. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. So let's move on to the natural treatment protocols. Well, as already mentioned, this is a situation for boosting your immune system, either in the prevention aspect or when you have an acute pneumonia attack anyway. So limiting your exposure to other people with the infection while at the same time boosting your immune strength is truly the best way here to control pneumonia transmission, and is critical, as I said, for the prevention as well as during treatment protocol. So improve your diet and your gut health. Bring in probiotics, which help the GI tract to establish a healthy bacterial microorganism that actually keep the bad ones in check as well. I also would bring in sort of antiviral herbs like astragalus root, licorice root, echinacea, absolutely big time here, but also vitamin C, garlic, and I always swear of turmeric, curcumin, fantastic, so anti-inflammatory and antiviral, antibacterial, anything works wonderful. Ginger, maybe speeds up the healing as well. So let's move on to the third part of this video, homeopathic remedies. Today I don't want to spend too much on supplements because I believe, with your lifestyle changes, changing your diet, boosting your immune system, and applying indicated homeopathic remedies for your individual symptomatologies, you can tackle that. It's very effective here. Homeopathic treatments for pneumonia is very beneficial for affected patients. These remedies help in providing symptomatic improvement from pneumonia and resolve also the inflammation of the alveoli of the lung. Now, in each case, the pneumonia, the homeopathic remedies need to be selected individually, according to the symptomatic presentation. So, as I said, some have more the nausea and the gagging, the other one have the chest pain, and I will give you the remedies for this individual expression. And that's why these treatments will work, because they match you, right? It's not just a one-fits-for-all protocol here. I really want to educate you that you can be a little bit more aware about your body and recognize your individual symptomatology, and then match it then with the right homeopathic remedy. Homeopathic remedies also have the ability to help incomplete recovery from pneumonia. So if you feel like there's always something left and you can't get over it, here it is. For guidelines and how to take the remedies, contact my practice Medica Nova at health@medicanova.net or your local homeopath. And I think in this case, book your appointment because you need professional help. The first remedy is called Bryonia alba. And it's a top grade remedy for pneumonia when you have the chest pain, mainly the chest pain, right? And you feel like you have this stitching pain, especially as soon as you move around or you breathe in. And often you see patients putting their hand on their chest because any movement makes it worse. Even just raising the rib cage, breathing in makes it worse, and you have this chest pain. The expectoration or the mucus which comes out can be rust-colored or brick-colored in nature. Maybe there's some blood involved. But usually it's very heavy breathing, difficulty in breathing, and there may be also fever accompanied by chills. So if you have chest pain every time you cough, the stitching pain, think of Bryonia alba 30. I would take, in acute cases, 1 tablet every 1 to 2 hours for a few days. Also, I want to mention, let's say, if the symptoms shift from stitching pain, then maybe you have nausea and vomiting. Then this is another remedy, in this case, ipecacuanha. You can switch with the remedies. Don't take them at the same time, but alternate them. And that would get you through the stages quite quickly. If you have pneumonia with difficulty in breathing, so it's not so much the chest pain, but you feel like it's really hard, labored breathing, the remedy Arsenicum album 30 may be indicated here, especially if you have this shortness of breath. It's typical, it's also a great remedy for asthma, right? So it's this typical asthmatic feeling where you feel like, oh my God, you're short of breath. It's also effective, funny enough, if you have consumed chilled food and then it causes you having pneumonia. Pain is located specifically in the upper third of the right lung. So that's your direction. And it's a guiding sort of keynote here. Another feature is this suffocating feeling, which gets worse, of course, on lying down and in the evening. Also, mentally, emotionally, there's a lot of anxiety involved. But in this video, I don't want to go into the psychology here with the homeopathic remedies, because this is really a physical symptomatology. If you have pneumonia with chest oppression, so you feel like there's a lot of weight sitting on your chest, phosphorus is a wonderful remedy, Phosphorus 30. There's this heaviness in the chest, and the respiration is therefore quite quickened. There's also this dry, hard, racking cough that can be bloody or purulent sputum. And in this case, phosphorus is very applicable if it's indicated for the left lower lung, right? Arsenicum was right upper, this is left lower lung. So it's great remembering that. And of course, when you lie then on the left side, the symptoms get worse here. If you hear a lot of rattling and mucus in the chest, Antimonium tartaricum 30 would be a wonderful remedy. It's almost like you hear it. There's this wet rattling and the mucus is gurgling in the chest, but it doesn't come up. It's very hard to bring it up. That's Antimonium tartaricum. Indicated more for the last stages of pneumonia. Of course, this video is more for simple symptoms, but I just want to share that with you as well, especially during this pandemic. Another important indication for using the remedy is the occurrence of jaundice with pneumonia, and here then the liver gets affected. If the purulent or the expectoration becomes purulent like pussy, right? Hepar sulphuricum 30 is the remedy. It's very offensive, maybe has a smell here as well. It's for pneumonia in a suppurative state, where it's not just a yellow mucus, but it feels pussy. There's a loose cough with this rattling of the mucus in the chest as well. There can be fever, and lots of chills are accompanied with other symptoms. So they lie in bed, have the cover, the duvet, right up to the neck, and then they just lift it a little bit and they experience a lot of chills. That's Hepar sulphuricum. But really think about when the expectoration in the mucus becomes very pussy. I mentioned others who have nausea, or the cough sort of stimulates this gagging reflex, and then they vomit. That's Ipecacuanha 30. The respiratory symptoms include this suffocating, loose cough without expectorations, totally opposite to Antimonium tartaricum, shortness of breath, and then the constriction in the chest. And as I said, the cough is spasmodic, right? It really cramps everyone together and then ends up in vomiting. So if I think about pneumonia in infants and children in general, the most indicated remedies are Antimonium tartaricum, Ipecacuanha, and Bryonia. In fact, I had a child just about a week ago in my practice who had the current pandemic infections, I'm not saying the name, and he experienced cough with this gagging reflex, and the nausea, and Ipecacuanha 30 healed it beautifully in no time. So Antimonium tartaricum, Ipecacuanha, Bryonia, these are the remedies you want to deal with in children. Antimonium tartaricum, again, just to recap that, is for this rattling mucus in the chest. Along this comes this rapid breathing. The pulse rate is also rapid and weak. Ipecacuanha works well when there's cough with bubbling rails more in the chest. The child can turn even blue, and I talked about the discoloration of the skin before, can turn stiff and blue because then the gagging reflex comes along. And then Bryonia is recommended when there's cough with this rust-colored sputum. That's really nicely here. In elderly people, I would say remedies like Carbo, vegetabilis, Seneca, and Phosphorus are very helpful. Carbo vegetabilis, you also get that in the health food store, works well for pneumonia with a cough, and there's a quick, short, labored breathing. Yellow or sticky mucus may be present. A burning sensation in the chest is another accompanying symptom. Seneca is useful when the chest feels more sore along with coughing. Again, the sputum can be very tough. Expectoration may be difficult, like Antimonium tartaricum. Phosphorus works very well then when the cough is along with this oppressed breathing, the weight of the chest, and can be a little bit of a bloody sputum as well. It's also recommended for treating paralysis of the lungs from pneumonia in older people. So you got quite a lot of tools here to tackle that, right? And especially if you live in an environment where hospitals maybe are not nearby. But homeopathic remedies are affordable, they're cheap, they're accessible everywhere. So have a little stash at home or your first aid kit. They usually last for a lifetime, depending how you store them. Keep them cool and away from light and any smelling substances, and you should be good to go. So I hope this short video has given you enough information to prevent and heal your pneumonia in the most innovative and holistic way. If you have any questions about the treatment plans or how to take this remedy, contact my practice Medica Nova at health@medicanova.net, or also you can contact me my website medicanova.net and have a look at the online academy, where you will find certified comprehensive home study online courses in homeopathy, how to treat the whole family or your friends, or how to apply homeopathy during pregnancy and birth and postnatal care, or if you ever wanted to learn about integrated mental health or quantum healing or health coaching, there's, I'm sure, a course for you and for everybody out there who is interested in just learning a little bit about optimal health. So till next time, much love, take care.